open gloving return demonstration.
Good day everyone, my name is Cañadoa, take up the course of Bachelor of Science in Nursing from Section BS and NU 203. So for today's video, I'm going to demonstrate or perform to you the open gloving return demonstration. But before that, I'm going to explain first what would be the purpose of using these sterile gloves. Well, the use of sterile gloves, it reduces the risk of contaminating the health workers' hands with blood and other bodily fluids. It also reduces the risk of germ dissemination to the environment. Moreover, it reduces the risk of the transmissions of the microorganisms and harmful pathogens from the health workers to the patients, and vice versa. Therefore, prior to the conduct of the procedure, I have performed as well through hand washing. And lastly, you must also remember that the use of sterile gloves does not replace the hand washing. And so, we must always remember that we must perform the hand hygiene before and after every procedure. So now let's get started.
For the preparation, you must check the client's record. Next, put a cup or mask if needed. Next, choose a appropriate size of sterile gloves. Next, ensure the sterility of the package of the gloves. Check for the expiration date and check for the dryness and intactness of the package. And lastly, inspect the condition of the hands and check if there is presence of lesion.
Come in. Good day, sir. By the way, I'm Cañadoa, your student nurse for today. So, as of now, I'm going to validate your identity. So, are you Elisha Saribokog, 19 years of age, and your birthday is on November 13, 2002?
Yes, I'm Miller.
Alright, sir. So, as of now, I'm going to ask you a question regarding to latex allergies. Do you have any latex allergies, sir?
No, I don't have.
Okay, sir. So, for today's session, I'm going to take your vital sign. But before that, I'm going to wash my hands first and wear some sterile gloves. So, just wait and relax.
Alright.
After that, you must provide the client's privacy. Then, don't forget to do hand washing for hand hygiene. First thing first, you must ensure that packaging has no tears or stains. Next, carefully remove the outer wrapper of the package. And you must be careful not to spill the inside content to keep the sterility of the gloves. You must make sure that you must place it in a clean dry surface and the area must be at the waist level. Next, carefully open the inner package. Using the thumb and the first two fingers of your non-dominant hand, grab the edge of the cup of gloves for dominant hand. Next, you need to slide inside your dominant hand. You must remember that you only need to touch the inside surface of a glove to avoid contamination. Also, you don't need to feel worry if the other edge is uncomfy because you can adjust it later. Next, using the thumb and the first two fingers of your dominant hand, you need to slide inside your non-dominant hand. You must need to carefully slide your non-dominant hand to avoid contamination. After that, adjust each glove so that it fits smoothly and carefully pull the cups up by sliding the fingers under the cuff. And lastly, you must make sure that you may feel comfortable in order that your hand can move freely. In removing and disposing of the used gloves, grab the outside part of glove dominant hand with the other glove head and avoid touching the wrist. Next, pull the glove, turning it inside out, placing the contaminated first glove inside the second glove. Insert the two first fingers of your dominant hand inside the cuff of the glove hand. Pull the second glove, turning it inside out. And lastly, using the bare hand, continue removing the gloves and dispose them in the proper receptacle. And don't forget to perform hand washing. Also, don't forget to assist the patient for sign of infection and evaluate patient's reaction to the latex. For the documentation, document the procedure and patient's response to the procedure, and document any patient's reactions to the latex, note type of response and reactions to the treatment.